Hello and welcome to the Interlink webinar series where we're talking about issues to do with gender, to do with transport and accessibility in global south cities. We've got a great set of presenters and Professor Schwanen will be moderating the session. So welcome to all our speakers, Sharmin, Nasrin from University Asia Pacific in Dhaka, Tanu, Priya from Toy in Norway, Beatriz, Mella, Lira, UCL still, I hope, I'm not sure, but you can say where you are now. I think you're maybe somewhere else. So welcome to all, and also thanks to Daniel Oviedo and Rafa Pera for organizing this webinar series with me. It will be recorded, and we will make the recording available along with the slides on the Interlink website through YouTube. So thanks very much, and also to Emma Sonover for being so great at getting all the information out. She's our network coordinator. So with further ado, Tim, I'll send over to you to introduce everyone.
Thank you very much, Karen, and hello everybody. Good morning, afternoon, evening, wherever you are. I'm delighted to be here today and to be chairing this, this webinar. And I think we've got a really distinguished panel of speakers today, which I'm delighted to introduce them to you. In a few minutes, we'll start with Dr. Tanu Priya Uteng, who's at the Transport Economics Institute in Oslo. She has a long history of working on questions of gender and mobility, going back to her dissertation about immigrant women in Oslo. She's done the book Gendered Mobilities with Tim Cresswell more than 10 years ago and has sort of published a range of papers on this theme. And she'll be starting with offering a broad overview of the issues that we're going to talk about today. Then we'll have Dr. Beatriz Mella Lira, used to be a postdoc at UCL at the Barrio School and is now in Chile at the BRT Center of Excellence and the Pontificia University Católica in Santiago, who's going to talk about the consequences of COVID for gendered mobilities and immobilities in one of Santiago's neighborhoods. Some really recent work, and I think really exciting, is going to talk about that. After which we move from Latin America to Asia to Dr. Sharmin Nasrin, who is assistant professor in engineering at the University of Asia Pacific in Dhaka, who is going to talk about walking in a low-income neighborhood in Dhaka. And she'll be talking about a methodology they've been using that allows the perspectives of different groups of women to be articulated and come to the fore. So a really exciting lineup, and I think it's only appropriate that I now hand over to Tanu to kick us off with her presentation. Tanu,
thank you, Tim.
The floor is yours.
Thank you. So share screen. Is the screen visible now?
Yes.
And it's the right format? Like,
I think we've got the presenter format, Tanu.
okay, just a second.
Yes, excellent.
Okay, perfect. Thanks a lot, Tim, for the introduction. So I'll quickly take you through an overview of how to actually structure the topic of gender and transport. And as you can see from the title, it's a long one. I won't be able to cover everything in 15 minutes, but I just wanted to put these key question notes because that's how we can start exploring the topic. And it's quite intense and dense. And what we have done so far in the last, I would say 15, 20 years, is basically scratch the surface of it. Although this topic started almost 40 years back in US, but the contexts are so different in the different countries and continents that it needs much more exploration than what we have achieved so far. So let's see what are the main findings on the topic. And this is applicable both to global north and global south. Though the extent varies, the main findings are almost the same. So when you categorize by the main topics studied in the transport discipline by trip purposes, trip chains, daytime distribution of trips, there's categorically differences between men and women. Women have fewer job trips and more shopping and escort trips. Women have more varied and complex activity patterns. There's more trip chaining. And as I said, there's more variety of activity which women are engaging in. They go out less by night and travel less often in rush hour. Licensing and car availability is higher for men throughout the world. And although in Western world, this sort of difference is decreasing, but still it's higher for men. When it comes to more choice, women are more passengers and men are more drivers. Women use public transport more and walk more often. Women have more multimodal travel pattern. When it comes to driving, and if women are driving, the preference is actually for driving smaller cars. And where cycling is a part of the travel culture, women bicycle longer distances. Trip distances and trip duration is again shorter for women, especially for job trips. So basically that means that the area they are navigating in for their job purposes is much closer to their home. So their radial spread is much limited than what it is for men. Women participate less in long distance commuting. Now, when you see the sort of role distribution, this is what I presented so far was from a very typical transport discipline. But when you look at the role distribution, it's markedly different between men and women, especially in middle and low income country. So this is some of the findings from Africa. What you find is the load carrying efforts is highly different between the genders, between men and women. And then again, women's participation in labor activities is quite different. They are more involved in food production, food processing, household and community activity. And this also filters down to the time usage. So this is from rural Port St. John's in South Africa and rural Flagstaff. And you see that the total time spent on daily mobility and unpaid work is 11.5 hours and 13 hours. And this has strong repercussions for how we are envisaging development in the future. Then again, when we look at the kind of modal distribution, we see that women are more walking and using public transport more. And these 4 factors, which is like accessibility, affordability, availability, and acceptability, these 4 A's need to be sieved through this gendered lens, which is often not done. And as you can see, this graph is an old one, but even now, when you look at different countries, and I have done a study of looking at different countries, whatever data is available recently, things haven't really changed much. It's still the same. And this is a very simple accessibility mapping, which was done in a town in China. And what it tries to show is basically that the access to men is inevitably higher, both at local and regional level compared to women. So the white parts in this map is with 0 accessibility. And you see for the female axis, you have a lot more region, which is simply not accessible to women because of a combination of these factors. And the range and extent and the sort of coming together of these factors may vary, but they inevitably harm women more than men. Given the way transport planning operates right now, how things are designed and how things are operated in this discipline. So with a short background, we can very briefly look at how things should have been done. So what the questions which needed to be asked was, what kind of daily mobility needs do women have? What are their limitations with respect to time constraint, financial and safety constraints? Can we minimize these constraints? For example, through spending less time and money on their daily traveling, plotting like what could they be doing else, which could benefit the society at large? And can they use their time differently? What ratio of women are in different employment services, manufacturing services, care services, etc.? And then there should be a routinized process of mapping, plotting, and establishing these interlinkages, which is rarely done. So sort of, provision of transport has its own logics, which doesn't really follow the life of people for which it is supposed to be designed. So how things are done is basically, it's a hegemony of trips planned for peak hour traffic. Women are not traveling in peak hour. Commute. Women are not commuting also in developing countries, because they are mostly either taking care of the house or having businesses which is tied to their local areas, or having some sort of home-based services, home-based businesses, which doesn't really cater in this kind of peak hour and commute fixations. And also employment and fixed areas. And the desired target groups are typically commuters, men with 9-to-5 jobs. This is the unit, the primary core module around which transport planning is revolving. And then factors like flexible trips, trip chaining, traveling with children, linking multiply geographically spread low-end jobs, accessing training centers, education, health centers. These are left out of this question of designing the primal model of transport. So, and the undesired transport groups are inevitably women, family with young children, and shift workers. And in light of sustainability agenda, as I said, that there is a sort of convergence happening between the travel behavior of men and women. But in Global South, it's still divergent. And I have put a plus sign here, which I'll explain very quickly. So access to modes, trip purposes, license holding, mode choice, and trip distance and trip duration is still divergent between men and women in Global South. But to a great extent, it has converged in the Global North, which means that the whole sustainability agenda, which is focused around increasing walking, bicycling, and public transport, is losing its ground in travel behavior in the Global North. But in Global South, there's still hope. There's still hope to maintain it, because men and women are traveling differently, and 50% of the population, if we roughly say so, is already having a sustainable travel behavior. So the biggest issue so far is public transport, walking, and bicycling infrastructure is given inadequate attention. The gendered nature of infrastructure is poorly understood. Daily mobility is still not integrated with development policies like health, employment, education, and welfare services. And the relationship between gender equality and sustainability is poorly understood or not understood at all. It's a sort of lack of discourse analysis in the entire transport discipline, both from engineering and planning perspective, because everybody is talking about, their own interpretation of the big elephant. But rather, what is needed is that we build a sort of cohesive picture. And to that end, some of my thoughts are, like, instead of classifying transport as hard infrastructure, we should look at daily mobilities as more a dynamic element. And even in Global South, there's a lot of talk going on mass and smart cities. So my point is that all these topics, which are gaining grounds quite swiftly in Global South as well, should be looked in relevance with sustainable travel behavior. And if women's travel preferences are made the unit of analysis, then automatically walking, bicycle, and public transport needs to be upgraded, not only from sustainability agenda, but also just like you already have a clientele base. You just need to support that clientele base to get the sustainability agenda goal cleared through. And this is very briefly how you can structure it. So this is based on Law's framework for understanding gender and mobility, and the blue boxes were added by Barbara Lenz. And what she's saying is that this framework needs to be analyzed in light of the smart mobility agenda as well. So you have to analyze division of labor and appropriation of smart mobility options. Access to resources also means interpreting access to ICT-based services. Who has access to these services which you're promoting? When you come to subject identity, then smart mobility options supporting or contradicting. In a lot of terms, it actually can be contradicting for a set of population. So the symbolic code of it and the new mobility services integrating into mobility practices. I mean, you can look at this, this slide in detail later on. But the core message is integrate things, integrate the role, the lived lives, the livelihoods, the kind of solutions you're proposing, the kind of funding you're providing. So all this needs to be seen more holistically rather than a piecemeal approach. Another thing is understanding the links between, another aspect is understanding the link between spatial planning, area development, and mobilities. And how can this be built into governance issues? So this is a picture from a rural part of tribal area in Madhya Pradesh. It's in central area, central India. And as a development program, these women applied to get an e-rickshaw. So this is not really a transport program. It was a development, a social upliftment program, which the government provided them e-rickshaw, and they trained themselves to become drivers of e-rickshaw, and they're taking these girls to schools from the rural areas to the nearby schools and health center. And this is the kind of, interlinkages which needs to be established, which is actually quite missing. So given the current system roles, jobs, and gender divisions, what are their mobility needs? Data collection needs to revolve around these topics rather than, being upside down. So not being fed by what is needed rather than just feeding whatever is available. So division of labor in different sectors, and also accessibility of women. How can transportation policies and investment ensure that accessibility of women increase? Are these systemic or systematic flaws? For example, throughout the developing world, what we saw was subsidized housing scheme and relocation policies inevitably harm women much more than men. They lose their livelihoods, they lose their entire network. And this is all these schemes are government-funded schemes, and they're harming women much more than men. So these needs to be viewed in a different light. And how do land use regulations or the lack of it affect the mobilities in urban and peri-urban areas? What we saw is typically land use regulations and mobility is not linked very strongly. I mean, from the research world, there might be concerns about it, but in the actual working of policy world, it's not happening. And also it's very important to understand, in light of the smart cities and mobilities agenda, what kind of mobilities are being supplemented or complemented or substituted by mobile phones, because this is not a flat bracket umbrella. It is quite divided. So policy directions need to focus on intersectoral collaborations and multi-stakeholder partnerships. And to that extent, I would like to give the example of cross-border trading happening in Africa. I mean, if you stop cross-border trading, on prima facie, it might sound very logical, it's illegal, it's informal, but it's actually women traders coming from rural area who were engaged in cross-border trading. And when you have a very strong policy stopping this, then you need to find out avenues. Where can these informal markets be shifted? This is more at a continent level, but at a local level, when you have interventions, for example, what we saw in Kampala in Uganda, where they simply widened the pedestrian pathway and allocated space for informal trading. It was primarily the women traders who were facilitated, and they made it legal to do these tradings after 6 in the evening. So police harassment was stopped by a very simple area decision, a spatial planning decision. National transport policies, they need to recognize all modes of transport. I have no understanding of why it is so, but there's such a strong focus on cars, on personal motorized transport. This needs to stop, because it's basically public transport, both the formal and informal, the public transport, which needs to be brought into the main domain of transport planning. For example, in India, what's happening is there's multiplicity of organization. And the distribution of power between union, state, and concurrent list is such that public transport does not figure in any of the lists. So nobody is responsible for public transport. Whereas 95% of the population is of the poor population and of women are using public transport. So as I've mentioned before, also redesigning of allocation and location policies. So infrastructure for car versus public transport, slum relocation policies, setting of satellite townships, low-income group housing location, training centers, health facilities, and market centers all need to be brought under the purview of accessibility analysis. And right now it's not so.
Well, thanks, Tanu. I think you need to stop there because we're running out of time.
Yeah,
Sorry,
so,
we haven't got time for the last couple of slides. Thanks a lot.
Okay, but that's fine. I mean, we can take it later.
Yeah, thank you, Tanu. We can pick up some of these points in the Q&A later on. We've already seen some questions coming in on the question and answer forum, and please do send us your questions so that we can pick them up and discuss them afterwards. We're now going to move on to the second presenter, Dr. Beatriz Lira. As I said before, previously UCL, now in Chile, the BRT Center of Excellence, and she's going to talk about the consequences of COVID for gendered mobilities.
There. Hello, everyone, and thanks again for the presentation team and for the invitation to present this seminar. Beatriz Lira, postdoctoral researcher at the BRT Plus Center of Excellence at the Universidad Católica de Chile. And I would like to start by introducing the amazing team I'm working with, Dr. Jaime Sosa, Dr. Leisa Garis, and Magdalena Rivera, all of them from Sadeus, who have helped me and have worked all together in this ongoing project. And today I'll show some of the preliminary results we have so far and some of the next steps we're pursuing for the next couple of months. So the context of the research is a transformative context produced by COVID-19. We start from the basis that social and physical distancing will change the type and the number of trips. We also know that perceptions of public transport have changed with the sanitary crisis, and we're already thinking about the ways of keeping public transport users and encouraging active travel. And we also know that the pandemic situation has meant a wide range of socioeconomic impacts and dilemmas. So in Santiago, the place where we locate this research, has suffered for almost 4 months of different types of quarantine, almost 2 months of a very restrictive aiming minimum movement quarantine. However, besides the lockdown, low-income communities kept moving. And the reasons for that were diverse, but mostly for the almost zero social security and the dependence of a daily income. So the nature of the activities in low-income communities made very difficult to obey the lockdown. The map on the left side, provided by Juan Correa, shows in dark some of the communes with a lower income profile and higher mortality rate. So this is just an example of how COVID has been affecting the different municipalities around Santiago in a different way. So in this context, the research problem is to understand how the pandemic has affected travel frequencies, activities, roles, and perceptions from a gender perspective through the recognition of the differences between men and women. Why focusing on gender? Well, we have many reasons for this. But first, immobility directly affects the most vulnerable people, and women's vulnerabilities tend to be overlooked. Secondly, we think that pandemic scenario has forced changes in trips, and we already know from the literature on gender that trip purposes and trip chains are different for men and women. We also think we need to develop more research focused on gender because this is underexplored in the Global South. And finally, because we want to explore how the care-related trips have changed over the sanitary crisis. Then why focusing on San Eugenio? San Eugenio is one of the neighborhoods located in the center of the city, in the municipality of Santiago. And actually, this was a bit of an excuse for us because we had the previous data. However, we think it's interesting to explore the impacts of the lockdown in the scale of the local communities. And today, having access to the basic needs as food and health is central. And this is almost the only reason for going out today in the pandemic situation. And again, for how underexplored local communities are in this global south context. The methodology, it's quite simple. We had a previous questionnaire, the data from a previous questionnaire in San Eugenio. We had 354 surveys in 2019, and we aimed to contact all the surveyed people. We called them back, and we only got answers from 96 of them. So this is a follow-up survey. We carried out this second survey, this second wave surveys a month ago during the second month of lockdown. And we carried out a comparative analysis of travel frequency for 5 different activities. And we added some open questions to this second wave directly related to the effects of the lockdown. So for some of the results show that for the pre-pandemic scenario, we found no gender differences. And we think it was because the survey never aimed to recognize those. Actually, that happened to us in a couple of previous studies. But we did find a relevance of roles. We found significant differences when women were the partner of the head of the household. And this is from a quite awkward question in a broader national survey, and we took it as it was. And we found significant differences when the woman was doing household activities. Then we analyzed 3 purposes and between the first and the second survey, and we found relevant gender differences. The figures here show how probable it is for men and women to reduce or increase the frequency of these 5 activities. Commuting, visiting family, health, shopping, and we said paperwork, but it could be like personal business, stuff like that. So for example, in commuting, both women and men tend to remain equal or completely decrease. For visiting family, health, and personal trips, both men and women decrease in frequency, and this was quite obvious. However, shopping is quite different because it doesn't vary significantly, so it sort of remains similar. We found commuting as the most binary answer, remaining equal or decreasing. And considering the literature, we didn't expect that both men and women reduce family trips. We would have expected women at least keeping similar frequencies, like based on what we knew before. So where are the changes? I already said that work was the category with the highest variation and highest reported trips. And we found that only around 20% of the sample from the new questionnaire is mobile or more mobile, which is fair because we're in a lockdown situation. But we also found that this immobility has been caused by unemployment produced by the sanitary crisis. And the figure shows in the first column that around 45% of the sample was mobile before, and now is immobile. And only a third of these people is teleworking, so the rest is unemployed. And in the second column, you can see that less than 3% of the people remaining immobile is teleworking. So there's a big issue there. Then we also asked open questions, and they were like open. And what we did was to extract from those answers a set of 7 categories. For example, if the person said, I've enjoyed this time with my family, that falls in the category of family. All these categories are quite similar to the analysis of trip frequencies that we did before. However, we found a very consistent repetition of lack of freedom, and that was new. And that was quite obvious again in a pandemic situation. And that was presented as one of the worst things. And the interesting thing is that doesn't fall into conventional categories, and it's directly related to mental health or well-being category. Similar question with changes in mobility. So the same concepts of lack of freedom missing going out, tired of confinement, feels like prison. Then for us, it was quite difficult to estimate models explaining immobility, but we know that we are in a transition or in a breakpoint period. And we know it's going to be interesting to have data in a couple of more months, so we can compare what we're doing now and what we had before. Then we analyzed the new set of data, the lockdown data. When we did that, we found significant gender differences, opposite to what we had before, especially in the activities frequency analysis. So being a woman or middle-low income increases the possibilities of reduced mobility. We also found, again, that the roles within the household were relevant. So men is more likely to be the head of the household, and reporting as head of the household increases the probability of mobility. What about care trips? Sorry. What about care trips? We think that care trips are relevant today and will be more relevant in the near future compared to the pre-pandemic situation. We actually think that the sanitary crisis has inversed the pyramid of trips, being the trips made by walking and cycling more important today. So that's something that we need to foster. We've had a very serious debate here in Santiago or in Chile about the city of 15 minutes walking here. And we found that the role inside the home has changed the nature of travel as well. And yeah, thanks. The figures here show that most care trips were performed by women before. So shopping, health, visit, these like personal business maybe is not related to care trips. But today, most care trips are made by men. So we couldn't explain the situation with the data we have so far, and that's something that we need to work further in the next steps. So some of the concluding remarks for this, care-related trips need more gender-based analysis. We will need to understand how that will change after COVID-19. Commuting trips will also potentially change with teleworking. Commuting trips today and eventually in the future may be replaceable. The immobility scenario is affecting beyond mobility. Mental health and well-being are really important parameters that we need to incorporate in this commonplace. And the sanitary crisis has evidence that the travel pyramid has reversed. Food, care, pharmacy, and family trips, those trips are more relevant today. And the next step for us is a qualitative study. So now that we have this almost done, we are carrying out some in-depth interviews in 3 different neighborhoods. One of them will be San Eugenio again. But actually, is for going deep into these particularities that we found in this study. Thanks.
Excellent. Thank you very much, Beatriz. Before we move on, there was a sort of a quick question about care trips in your study. And I was wondering if you could explain a little bit more about what types of trips you define as care trips.
As care trips. Yeah. Let me go back to the slides. So, well, we define shopping, health, and visiting family or friends as care trips. The thing is that we have the data from the previous questionnaire or the... am I sharing the screen? No.
No, but it's fine.
Oh, okay. Well, but we had the data from this previous survey. And we took all of those trips, like related to shopping, trips to go to the doctor or taking someone to the doctor or visiting friends and family as care trips. And then we sort of ask this again, and that's how we define care trips. So we know that it was a little bit constrained, and we could have had a broader definition of care trips, but as we were doing this comparative analysis, that's what we could extract from the previous survey.
Excellent, thank you very much. And that's a very useful addition to what was a wonderful presentation. We move on to the third and final presentation by Dr. Sharmin Nasrin from University of Asia Pacific in Dhaka, and she is going to talk about walking audits, and the work that she's presenting today is funded by a follow-up project to Interlink, and it's part of a Sustainable Transportation Equity Partnership project. Sharmin, the floor is yours.
Thank you, Tim. Hello, everyone. Thank you so much for giving me the opportunity to talk about my project titled Walking and Talking with Low-Income Women in Dhaka City. The background of this project is actually, we did this project under Sustainable Transport Equity Partnership, which is in collaboration with University of Asia Pacific, University of Leeds, University of Manchester, WAC 21, UN Environment, and the University of Nairobi, Kenya. This research was mainly funded by Research England's Global Research Challenge Fund. So STEP mainly built upon the previously funded the network that is in short form that is called Interlink. So while we did Interlink, one of the gaps we identified is the severe inadequacies of working environment in transport policy in Dhaka. And also this project is very important because low-income women contribute significantly in country's economic development. Because we know that garments industry is the actually main GDP generating industry for Bangladesh, and low-income among the employees, low-income women are about 80% actually consist. So this project is very important. Oops. So the study area was mainly Coral, that is one informal settlement, or locally we call it like Islam. So this is located beside Mohakali, Gulshan, and Bonani area. In this figure is seen in the south. This is Mohakali, and Bonani, Gulshan is in the north side. So this is one of the largest informal settlement, which is located just at the heart of the Dhaka city. And Bonani Gulshan area is like one of the affluent area in Dhaka city, and population of this area is over 150,000. And this this study area, Coral, is surrounded by water everywhere. Everywhere this is water, so it is almost like an island. So. And most of the pathways or routeways inside Coral are unpaved. Recently, some of the NGOs actually had taken initiative, and they have upgraded the pathways into paved roadways. So and the morphology actually it varies because in at this part this is a low lying, so this is more flat form, and mainly less wealthy people lives here, and this part is actually high aging area, and this is less flat form, and comparatively wealthier people actually lives here. So the research method what we actually adapted for this research, focus group discussion, that was perception of participants from discussion, and also workability audit. So that is perception of participant from actual experience. In the focus group discussion, actually 4 interactive discussion was held, by one with working women, they are household worker, another with working women, garment workers, and elderly women and female children. And each groups about 15 to 25 participants were participated, and mostly mainly we did audio and video recording while doing conversation with them. And while doing workability audit, we did assessment of route pathways, working conflicts and hazards, and mobility patterns and access to destination, and safety and security. So these are some photos of while we did a focus group discussion with 4 groups. And from the focus group discussion, actually, what we found out in their statement under the routes and pathways, there is only one proper access road at the moment to enter into Coral Islam. For reaching main roads, I need to walk through my neighbor as houses are built beside each other. Our standard is low, so when NGOs constructed paved roads, we were very happy, even though it is not comparable with roads in Gulshan or Bonani. Rich people will take my home, so I want roads narrower inside slum. And under walking conflicts and hazards, their responses were, access road inside Coral is hazardous as it is narrow and used by different types of vehicles. On roads near Bajar, the stuffs are usually piled up beside the road. During rain, I need to walk through locked water that causes infection on my feet and leg. After walking long distance on bad roads at night, I get exhausted and tired. I need to wake up very early morning to travel. I need to be prepared for any adverse situations such as bad weather or road closure, etc. As I'm tired after a long walk on bad roads, I cannot give any quality time to my family. And under mobility pattern and access to destinations, their responses were, even though no walking facility, no other option than walk. Sometimes it takes about 30 minutes to reach my workplace. I do not belong to the systems as I don't have good working facility and limited affordability to obtain public transport. After overtime at night, we come back from work in a group. When there was boat, I could travel very easily. I could cross the lake with two Bangladeshi taka. For students, this travel was free. Even we, who didn't have money, they could travel easily. Now I don't have this facility as authorities stop this service. Under safety and security, their responses were, I, as a female teenager, don't feel safe inside Coral. This is mainly because eve teasing occurred inside the slum. As there is no motorized vehicle inside, I feel safe cycling, even though cycling is not very common, those who are teenager. With the initiative, or Coral community security guards are appointed at night. So inside slum, we feel safe to walk at night. I feel safe inside Coral, but near the access road, there is problem of safety. When I come from work at night, I prefer to come in a group. There were several fire incidents happen in Coral. There is no access to firefighting vehicle into the middle part of the locality, which is the denser part. Fighters are very reluctant to as well, because most of the time they come after 2-3 hours after fire started. So I don't feel safe. I feel I may die at any time. And now workability audit part. Actually, workability audit had been done with the shared travel reality of individual deficient environments tool. In short, that is called Stride app. Stride is actually developed by WAC21 and the Sustainable Transport Research Department of the University of City of Chile, Santiago, to evaluate the workability in the field. So each participant's perception of their working environment were recorded. So this is the interface of the Stride app. So what they had to do first, they had to register themselves in the Stride app with their characteristics, with their gender, their age, their ability to work. And after registration, they had to vote. This red means there was significant issue, and yellow means moderate issue, and red means like it's a bit safer. So while they walked through their road, they had to vote based on their perception, how they are feeling. So you can see this is a very quite significant issues, because in this part they are actually mostly yellow and red. So under the workability audit, the parameters what we have adapted: availability of footpath, safety, security, inclusiveness, infrastructure ability, comfort or convenience, personal preference, and time of travel. And duration and time of workability, what we did 3 consecutive days, 11, 12, 13 March and 2019, from 12 p.m. to 5 p.m. And all 3 days were sunny with good weather condition. But because there were rain, 5 days before, most of the many parts inside Coral was like muddy and waterlogged. So even though sunny, the working condition was not very good, and participants were selected randomly, and surveyors actually accompanied them while they voted their responses. So these are some of the results. This is a wireless road. This is Mohakali. So this is the only access road towards to go into Corail. So this starts from Mohakali and ends it in Bonani. So this is 5-meter width main access road to enter into Corail, and mostly pedestrian, motorized and non-motorized vehicle use this road. And if anyone wants to go to Corail towards Bonani, they have to actually take right turn. This road takes them into Corail. So this is also very narrow road. This is called Bow Bazaar Road because there is a very big grocery market. So that's why that is called Bow Bazaar. So that road is actually takes the people to inside the Corail. And another road, there is small part is YOLO, that this road is being built. This construction hasn't been done yet, but Corail resident actually they have doubt whether they will be allowed to use that road. And roads in the dense area, they are very narrow, sometimes even 2 feet width. Not even rickshaw can enter into this area. So these are some pictures. This is the entrance of the wireless road, access road, and here this is Bow Bazaar Road, and this is one picture that shows the in the very dense area how it is. So these are some of the stride result. This stride result assess walkability from bus stop to Corail. This is wireless road. So there is significant issue that as mostly red and yellow. And this is stride result from Mohakali to Corail Bow Bazaar. There is also significant issue. And this actually picture shows stride result for pathways inside Corail. So a lot of issues because mostly red and yellow. And under the walking conflicts and hazard on the access road or near the access road, pedestrian and vehicle share the same space, so it's very dangerous. Accident can happen anytime. Pedestrian crossing is absent throughout the road, and most of the section of the roads are very dirty and garbage everywhere. So this is for walking conflict near the Bow Bazaar Road, because that is one of the very important road in Corail. So Bow Bazaar Road is occupied with piled up stuffs from shops. This narrow road, which is even less than 5 meters, is used by both pedestrian and non-motorized vehicles such as rickshaw, bicycle, and van. During rainy season, this road becomes unusable due to waterlogging and muddy condition. Emergency vehicle actually cannot enter into into Corail. They can enter only until Bow Bazaar Road and TNT Colony. After that, no motor vehicle can enter. So these are the picture. This is also, you can see that muddy roads and rickshaw and cart is going through this road. So these are the stride result for the roads inside Corail and stride result near school. So there are significant issues. So here some this picture showing their walking conflicts and hazards inside the pathways. So you can see there is low-lying elastic cables, unstable slab, and uncovered pipe. And here also, even though this road is near Bazaar and is it looks quite good, it's paved, but still there is temporary unstable slab, wooden log, and this is uneven path. And this is also very dangerous because there is a canal, and people actually walk through this. So under the mobility pattern and access to destination, time taken to cover the whole area of Corail, it takes about 5 to 60 minutes, depends on destination and route. And as there are not many alternatives, only one access road, sometimes they have to take longer route to reach the destination. And motorized vehicle can only enter till entrance till Bow Bazaar. Most common motorized vehicles are pickup, small van or motorcycle, usually provide supply and goods to serve and services to shops. And non-motorized transport, mainly pedestrian, bicycle, rickshaw, and handcars. Pedestrian traffic usually very high, especially during early morning and mid-afternoon and late evening, when residents move out, heading for various activity destination and back to the settlement. And their main mode of transport is mainly walk, because they can't afford. And female garments worker who need to come back from work at night after their overtime shifts, mainly they come in group, or if they walk, or otherwise they have to take shared rickshaw because they can't afford. So under the safety and security, from their perception, from their actual experience, in coral resident place, security measure largely in the form of absence of basic infrastructure. So inside actually there is no motorized vehicle. So their main security is the absence of infrastructure. They don't have any walking facility. The walking infrastructure that what they have, that is very insecure and unsafe for children, women, and elderly. And even though some sections are paved, they are not properly built. So those uneven roads or uncovered manholes or manholes covered with raised temporary slabs actually causes accident. During night, lighting is not sufficient. So lack of lighting makes residents more vulnerable to accident. When they walk, they can't even see properly whether there is any hazard on the walking route. So due to waterlogging, pedestrian accident is very common in coral. So female commuter at night actually come in group as they do not feel safe outside coral and near the entrance. However, like inside coral, they feel more safe. So these are some of the recommendation. So slum, if uplifting should be the option, not the eviction. So by improving their mobility, slum should be uplifted, and government and NGOs are already actually taking already has taken initiative to make working environment good, but they can take more initiative to upgrade their working facilities. Proper drainage facility should be implemented, and private companies can actually work there, so they can like implement bicycle hire system. And access road to coral, of course it should be widened, because most of the roads being used by different type of vehicles and pedestrian. And water transport can be implemented. Eventually it can be extended to whole Dhaka. So one example we already have in Dhaka, that is Hatirjhil water transport. So and access road to water transport should be improved for work, what they don't have now. And overall working condition in Dhaka should be improved. Service amenities such as toilet, etc., resting place, etc., should be implemented. And most importantly, the water sensitive walkway or sustainable drainage system can be implemented, and coral can be a pilot project. Ultimately, that pilot project can be implemented in whole Dhaka city. And the next, these are some like recommendation from the recommendation. This is already there.
Sharmin,
So
sorry.
Like it can be extended to whole Dhaka city. This is Hatirjhil area. This is like image.
Sharmin,
Yeah,
I think we have to leave it there now, because
okay.
you've gone well over
I'm
time and we need a discussion. So thank you very, very much. That's a great case study.
I am already done. Thank you.
And,
thank you.
We can see your slides later. Thank you. So thanks.
You.
Sorry for butting in, but I think we need to have a reasonable panel discussion. Thank you.
Okay.
Thank you. Just to kick off the discussion part of this webinar, I was going to start asking a question for Tanu. Tanu, what do you feel are the burning issues when it comes to gender and transport that we need to look at and that policymakers need to look at in the post-COVID era, with a focus, of course, on the global south?
Yeah, I think the first thing in post-COVID era is two things. It's affordability. So what's happening during the COVID times is like there were reduced seats on informal public transport, and invariably the prices shot up. So a trip which would cost ₹10 in India, like in one part of India, I'm aware of that situation, was 25 rupees for the same trip, because capacity was reduced on these tuk-tuks, and it affected women the most. Because and so the pricing mechanism needs to be looked at, and the taxes need to be reduced on public transport. There's absolutely no reason why taxes are high on public transport, and why informal transport, or intermediate means of transport, these are not part of the main transport planning exercises. It's not part of the national transport plan. So I think that kind of just leave it on the system to take care of attitude by the government needs to be checked. And on one hand, you're talking about sustainability, you're talking about being smart, but have they really understood what the word smart or the semantics of the word smart entails? I mean, it's not just about technology, it's about giving access to everyone in both physical, in both the real and virtual world. So I would stick to the 4 A's that I presented, you know, affordability, accessibility, acceptability, and I forget the 4th A. But anyway, but, and also acceptability, like for example, what Sharmin was showing, if safety is not there, if security is not there, women will not use it. So you have to make sure that it's safe, secure systems. And topics like, you know, apps like Stride and Safety Pin, these need to be promoted, and these need to be promoted at all levels, at area levels, at city levels, at regional levels. And then this whole interaction of macro, meso, and micro solutions need to be put together. So yeah, I think that would be my take right away.
Yeah. Just to follow up on that, would you say that offering free public transport for women only would be a good way forward?
Not really, because in the global south, a majority of public transport is run by the private sector. And the moment you make it free for women only, there will be a sort of exclusion of women. They will not take women, you know, women travelers, precisely because they lose money. That sort of policy can be implemented only when government is ready to take that entire burden, and only when government is providing accessibility to all areas. I mean, even in the capital city of India, Delhi, the formal DTC buses, which is owned by the government, plies on very, very few routes. It's the other private market which is catering to accessibility. So you can't, and it's not just about money, it's about the routes. Where are these routes? And what time are they flying? So it's not just about money, really.
Okay, thank you. I'm going to move to Beatriz, and sort of following on from what Tanu was saying. Would you say that in the Chilean context, free public transport for women is just as unhelpful as it would be in India?
Yeah, I was actually, I really wanted to comment on that because there's a lot of discussion how free should public transport be after of this pandemic situation, because we're trying to foster people to take more public transport. I don't think it should be only for women. I think it should be as free as possible, considering all the constraints that we know we have for having a free public transport. We know that there are many, many reasons for being against that, but we know for sure that it could help people to afford to move and to go to their places. But I think it's important, first of all, to ensure the sanitary safety in public transport. So before taking that alternative, probably in parallel lines, we should be discussing how we are ensuring sanitary safety, physical distance